Thank you to SAGES for the opportunity at the podium and to the session chairs for the invitation, especially to Dr. Nicole Fearing. I've been asked to speak on behalf of mid-career challenges and unexpected adversity. I have nothing to disclose. I guess I was asked to talk about this because about 2 years ago, I made a huge change in my career. After completing my surgical training in Boston in 2008, I practiced. My first job was an employed position with an academic affiliation. Teaching responsibilities were included. And after that, I practiced for about 8 years in private practice in a community hospital with an academic affiliation. And 2 years ago, I was given the opportunity to move to Miami to start a bariatric program. And after lengthy discussions with the family, we packed our bags, got in the car, and drove down to Miami. So what are some of the challenges I've faced since making this decision? I've been building a practice in a location without any established professional relationships. The only people I knew in Miami were my husband's family. I felt a little bit like the guy in the cartoon where he said, "Hey, Gary, I befriended you on Facebook, once upon a time. Do you mind sending me some patients?" And obviously COVID pandemic, which has affected everybody, it's been difficult to establish relationships with referring physicians and with patients. The elective cases have been on hold. The office has limited the amount of patients I've been able to see. My social skills have, obviously suffered significantly, and sometimes I feel like Jack Nicholson, either in isolation with my family or isolation with my coworkers in the hospital. Some additional challenges: currently in an employed model, where the only specialists are, only the specialists are employed, The referring physicians are private, so they have no real reason to refer to me other than, if I've established a relationship with them. Other challenges and adversity that some of you have faced in your career could be losing or adding a new work partner. This may affect the call schedule or referral patterns, changes in your organization, new administration, practices being bought out, other practices moving into or out of your organization. You may have now new teaching responsibilities you didn't have before COVID-19. We talked about the workforce may be redirected to assist with COVID patients, or changes and challenges in your personal life, which could include children, divorce, family illness or death, and partner career goals may not align with yours. The best advice I could give you is that you are your best advocate. Change may be positive. If you're currently not happy with your current position, you have many different options, from private practice to employed to community to academic, rural versus city. You may decide to pursue an administrative role or teaching. You may go into industry or practice in a different location. What I wish I knew earlier: there are many colleagues willing to help. You just need to ask. Some of them may have been through similar challenges. You can learn from their experiences. I've been fortunate to have Dr. Fearing around, multiple phone calls, texts, emails, and everything to help with these new challenges. Don't forget about self-care. Make time for it. Exercise, get your health checkups, take time off, make time for family and friends. Retail therapy has helped me immensely. Travel, hobbies, you name it. Don't forget to negotiate. You are a valuable asset. And it's not only to negotiate about salary. You should negotiate time off, your call schedule, benefits, work schedule, protected time for administrative work, a bonus structure, salary for directorships, and teaching responsibilities. If you were moving to another state like I did, find out how long it will take to get on new insurance plans. It took me almost a year to get on some of those plans, which is a huge hurdle. Find out how long it's going to take you to get your state license. Inquire about referral patterns. Where are the referrals actually going to come from? Was there a huge turnover in that practice before you joined? Is there a real need for you? Why are they really hiring? Talk to your mentors, as was stated before. Review your contract, including malpractice coverage, tail versus occurrence, restrictive covenants. Is there a niche for you? Would you be able to build a new program? What does this look like for you in the future? As far as building your practice, I think some of this has been discussed earlier, but what I've done so far to help build my practice has been to set up time to meet the referring physicians, PCPs, volunteer to give talks at local or national level, give talks at your institution. That's how the other doctors will start to know you, so will the nurses and all the other employees. Volunteer to give grand rounds, educate your nurses. Patient education is also important. Marketing was discussed, and we also talked about asking your patients to write reviews for you. I think that's key. Calling your referring doctors back to update them on their patients. Again, get involved in local and national professional societies and be patient. It's going to take a while. Mentorship was discussed. It's coaching and developing a relationship with an individual with the goal of personal and professional growth. I've been talking to my mentor, Dr. Dan Jones, every step along the way. Qualities of a good mentor include serving as a professional role model, stays with the individual in terms of time and effort, is compassionate, kind and supportive, acts as a critic, evaluator, and assessor, and is a leader in the field and challenges you with your struggles. The mentors can provide insight on how to navigate the system. They can talk to you about institutional politics and help you achieve your goals. They can give you advice on practice management, including financial and business implications. They can give you advice on research, academic medicine, how to network or introduce you to people. They can help you build professional relationships. They can give you advice on work-life balance, personal growth, and obviously give you advice on patient care. Sponsorship is a step forward for mentorship. It is the utilization of power and influence to advocate for an individual. This can be in your own institution or elsewhere. They act on your behalf. They may recommend you for a leadership role, an award, or a high-profile speaking opportunity. They can advise you on new professional opportunities or offer you a new job or connect you to someone that knows about a new job, and they can help you with promotions. There's also multiple leadership training programs. I've listed a few here, from SAGES, the American College of Surgeons, Association of Women Surgeons, Harvard Medical School, and Drexel, to name a few. I'm still working on building my practice and happy to take any more questions at the end. Thank you for the opportunity.